Hey there, VCE HHD students. My name's Andy. I'm a VC Health and Human Development teacher. In this short video, we're going to look at improvements in medical technology, and this is relevant to Unit 3, Area Study 2 for the 2025 plus HHD study design. If you don't already, there's lots of ways you can engage with the Health Resources Hub. If you're on YouTube at the moment, you can subscribe with the button in the bottom corner of the video there to our YouTube channel, where you'll get alerts to all of our new videos across the year. We've also got our website, thehih.net.au, where there's lots of opportunities for students and teachers, and that's being updated regularly, so please check that out. We've got our Instagram, TikTok, and Facebook pages where you can follow us and get alerts to opportunities that are coming up throughout the year, as well as our new videos, and also our email, info@thehih.net.au, if you've got any questions and you'd like to get in touch. Okay, so what parts of the course does this video relate to? So you can see there the Unit 3 key knowledge and key skills that this is linked into. So over previous videos, we have been looking at reasons for improvements in Australia's health status since 1900. And so we've looked at the old public health and biomedical approach to health. And so this one here is focusing on improvements in medical technology. And so that is in some ways linked to the biomedical approach to health, and we'll touch on why that is in this video. And we'll also have some future videos coming out soon on the social model of health and the Ottawa Charter and the relationships between the biomedical and the social model of health. So look out for those as well. You can see the key skill there is analyze data that shows improvements in health over time and draw conclusions about reasons for improvements. And so this example here about improvements in medical technology could be linked into some of those reasons for improvements in Australia's health status and health over time. Okay, so when looking at this point about improvements in medical technology, I mentioned that it can be linked into the biomedical approach to health. So you'll see here it mentions that alongside old public health initiatives, the biomedical approach to health was also working to improve Australia's health status, and that this model involves health professionals such as doctors diagnosing a health condition or illness, and then implementing a treatment plan to help cure or return an individual to pre-illness state. And so we did elaborate more on that biomedical approach in a previous video. So if you haven't, please go and check that out. But it also mentions there in bold down the bottom that this approach relies heavily on the use of medical technology to diagnose and treat disease. And so that's linked into what we're focusing on today. So knowing some examples of improvements in medical technology over time is a good idea, I think, going into your assessments this year and the end of your exam, because you can draw on this obviously as an example of the biomedical approach to health, but you can also, if individually asked about just an improvement in medical technology and how that might have contributed to improvements in Australia's health or health status over time, have some examples ready to go. So I think that's why this is also important, just to sort of focus on as a bit of a side note to also knowing examples of the biomedical approach to health. Just a reminder, if you're a Unit 3 and 4 student, you can see at the bottom of the slide there, if you head to our website, thehih.net.au, we've got a free student newsletter that's coming out twice a term this year. It's got free SAC and exam resources, as well as some tips and advice. So please head there and sign up using the link on our website if you haven't already. Okay, so here are a few examples that you could add to your notes for improvements in medical technology over time. And so for each of these, I'd be thinking about, okay, well, now that I've added this example to my notes, how could I link this into an improvement in Australia's health status? And so we'll look at that in a sample question in a moment. So you can see there some inclusions or some examples of these improvements in medical technology are development of new antibiotic medications. And we've mentioned previously that antibiotic medications can treat things like bacterial infections. And so for some of those conditions that were relatively prevalent early in the 1900s in Australia, such as things like cholera, okay, and also tuberculosis. And this development of new antibiotic medications would help contribute to treating conditions such as those. New diagnostic tools such as MRI, okay, so that would help to diagnose a range of different health conditions, including things like cancers and tumors, and that means that people are then able to get, okay, treatment earlier and more targeted treatment, helping them to then hopefully be free of that condition and improve Australia's health status. New radiation and chemotherapy treatments, once again, a lot of that can contribute to treatment of conditions such as cancer. Robotics developments that can assist surgeons to improve the accuracy of their surgery, and so that can obviously help these surgeons to be more targeted in the way in which they conduct their surgery and less risk, I guess, of anything going wrong during surgery, and that means individuals are more likely to receive appropriate treatment to improve their health status, and also nanotechnology that can help to deliver targeted treatments to specific organs or cells. And so that might be, once again, in relation to treatment of immune conditions or diseases such as cancer. And so in relation to these improvements in medical technology, you don't necessarily have to know a specific condition that they each link to, but it's not a bad idea if you can, okay, have examples like that, because then you can obviously link into things like morbidity and mortality and life expectancy, but you can also just sort of generically link that into reductions in sort of premature death and how that might have contributed to improvements, say, over time, Australia's health status, such as life expectancy. So you can see that mentioned down the bottom, this has made significant contributions to improvements in Australia's health status since 1900. So here's a sample question and answer. So the questions there asking you to use an example of improvement in medical technology to outline how Australia's health status has improved over time, so for 2 marks. So you can see that in the sample answer, it mentions that improvements in medical technology, such as the development of diagnostic tools, such as MRI, has contributed to diagnosing health conditions earlier and more accurately, such as cancer tumors. And that's contributed to more targeted treatment for such conditions, and that can help to increase Australia's health-adjusted life expectancy over time as people are spending fewer years in poor health. So there's obviously quite a few ways you could link that into health status in that sort of second half of the answer. So essentially there'd be a mark there for that sort of first sentence, the example of medical technology, okay, and then a link in the second sentence to an improvement in our health status over time for that second mark. Okay, hopefully you found this video useful. As a reminder, the ACE revisions question book that I've worked on for the 2025 plus study design for Unit 3 and 4 students has over 500 marks worth of practice questions, which are organized into sort of topics. So it's ideal for SAC and also exam preparation at the end of the year. It's got a full chapter on answering extended response questions as well as sample questions and answers. And it's also got a full trial exam with obviously sample answers as well. So if that's something you're interested in, you can head to book.acedvce.com and order a copy, and that'll head out to you on the post. And as I mentioned earlier, head to our website to check out our other current opportunities. Thanks so much.